Alrighty. All praise to the Almighty. It is complete. I made it to the seat. Ultimate Health with Nortey by Nature on a Sunday, 2:05 almost. Let's take some current trending praise. Now, why should that be a problem for anybody? Ashihuaymo. Always blessed on Joy 99.7 FM. Ultimate Health. Listen, every Sunday, 2:05, we come alive. If it impacts on your health, your well-being, we'll definitely talk about it with the professionals, the practitioners, top-notch brought into the studio, or on many of our other platforms.
You know it's another OPK classic.
Today I take a look at artificial intelligence, AI, and also give a peep at an interactive platform being harnessed to support and empower newly diagnosed breast cancer patients. So on Zoom I have Dr. Priscilla Van Dyke Say. She's the executive director of the Global Outreach Consortium, and she's a consultant family physician. Doc, I hope you can hear me. Priscilla, are you on the line?
Yes, hello, good afternoon.
Good afternoon. An old friend of the program, prodigal friend.
Yes.
Great to have you. Right, we'll talk a bit about your projects that you're running. In the studio also I have Dr. George Aqua. Chale, George's CV, Chale, these days is ballooning, Is it AI or is actual merit? And well, let me call him a physician. He's got qualifications in public health. He's done data and machine intelligence and all that at MIT as well. He's the medical advisor. Are you still medical advisor for the Guinness Ghana Limited?
Yeah.
And many other things. He runs a course in, is it digital medicine?
Yes, sir.
With the College of Physicians. And he's spearheading that also, and also doing community health. You're both welcome, Priscilla and George, to Ultimate Health on Joy 99.7 FM. I'm trying to do a delicate hybrid, right? These days, there's a lot of innovation in healthcare delivery, even in training and many other areas and aspects. So it's not, by accident that we're discussing this. I know, George, that the College of Physicians will be hosting, is it tomorrow?
Tomorrow afternoon.
Right, you're giving a presentation on AI in medicine now and the
now
future.
In the future.
Right?
Yeah, yes, sir.
So we got to be looking at these things. Priscilla, your team also, Global Outreach Consortium, is running 3 sites or 3 facility or 3 hospital program called Bisayen. Ask Us, Touch Us, which is targeting empowering newly diagnosed breast cancer patients. So it's all within the same spectrum, if I can say so, right? So let me take off with you, George. AI, I teach you guys will both know. I teach psychology. Learning is one of the basic foundations, right? We know we can learn. We know we have the capacity to learn, as have other organisms. But when we start talking about artificial intelligence, some say artificial learning, what are we talking about?
We're talking about how machines can learn. Just as human beings can learn, machines can also learn. Machines have, let me put it this way, evolved to also learn. In other words, scientists have studied how human beings learn, and they've modeled ways for machines to do the same thing. So they can think and reason just like us at the moment and perform tasks that ordinarily we would have thought of to be relegated to human beings. So computers can now write essays, they can write poems, they can make diagnoses.
You can't even argue with somebody freely. You are debating on a platform and somebody's going to ask chat box and they are giving you answers. So that's what we're talking about.
Exactly. ChatGPT.
A system that is able to reason, analyze data, look out for patterns, consequences, and so on, and therefore ultimately make choices.
Right.
That's what AI is.
That's what AI
Artificial
is. Intelligence.
All right. So, for example, I can ask Alexa, delete Abeku. And Alexa will set upon Abeku.
Exactly.
So many of you listening to us currently, you're using many forms of AI. We're hearing of driverless vehicles and many other things, right? I remember a couple of years back going through Joburg, and on our approach to Joburg, we're told that the weather is bad, so the plane will land itself. I said, hey, what kind of joke is this, right? So we're looking at something that processes the weather conditions, decides what to do, and the pilot basically may be watching. Right. I know there are different categories: supervised learning, unsupervised learning, reinforced learning, and so on. We'll get to that. But your business really is harnessing this in the field of medicine.
Yes, sir.
Right. And this is not new, right? But we now have to contend with it whether we like or not. And for folks listening to us, I'm looking at George and I'm looking at doctors employing many of these, should I say, tools and solutions to essentially or literally make themselves redundant. George, is that not what you're doing?
Some way, somehow, consciously or unconsciously, a lot of things are being relegated to machines to do. It's like we don't really give a thought to it, but it happens day in, day out. From something as simple as going on to Google to make a search for advice on something, or to any of our chatbots. We just feel it's a machine, it's a computer, we release that task to it, and it does it. And some of our restaurants these days even have robotic waiters, which can
I hate it when I go to a restaurant, and instead of giving me the menu, they say, scan it.
Exactly.
But that's where we're headed.
That's where we're headed.
So essentially, and maybe you may be looking to, should I say, devolving yourself of certain tasks and processes in healthcare delivery.
Exactly.
In medicine.
Yeah.
Wow. How far, when you look at it, I know we're now running programs, training, and all that, building the capacity.
Yeah.
But are we anywhere near that?
We are gradually preparing, I must say, subconsciously. We haven't yet come up with formal structures and policies to direct these things, but day in, day out, it's keep creeping. It's situations creep in. I mean, you go on the wards, house officers are battling with the case. The next moment, they've entered it into Chat GPT,
Right?
And then it gives some solutions, and then people may agree or disagree. So.
Right.
It is, I don't know, that's how technology is. It's a force. It just drifts into society.
Okay.
And it's up to us to consciously put in regulations.
Okay. Folks, so that's Dr. George, Henry George. He likes the royal names. Aqua tells you he's from Winneba, right? But yes, he's looking at and he specialized and done some work in the applications of artificial intelligence in health delivery, in medicine, healthcare. If you have any questions, concerns, I'll be putting him through the drills, the kind of areas of application, the concerns.
Yeah.
Right? We hear or automated car or Uber that cause some problem and other things. But generally, in many respects, the advantages seem to outweigh the risks and disadvantages. Yeah. I've read research papers and watched a lot of, should I say, audiovisual evidence of AI being used to scan, let's say, scans, X-rays, and comparing them with a massive pool of data and actually clustering and, should I say, cutting to size what the problems may be and assisting doctors in diagnosing and pinpointing certain things. George has been doing some work in looking at even receptor sites and other areas. He's looking also to do something wonderful with breast cancer treatment and management. So I'll come back to George. Dr. Priscilla Van Dyke say, I notice now it's Dr. Pris.
It's still Priscilla.
You're getting funky.
Yeah.
But tell us a bit about your NGO, Global Outreach Consortium, and then this BISAYEN project, which I understand to be an online support platform for newly diagnosed breast cancer patients, right? But what is the Global Outreach Consortium, of which you are the executive director?
Yes, thank you very much, Nortey, and good afternoon to your listeners. So, Global Outreach Consortium is an NGO that was co-founded by myself and Dr. Naomi Apia and Madam Erasing Cancer way back in 2018. So, our main goal is to provide healthcare to the underprivileged in society using education, screening, and subsidized healthcare. And so we do this by raising funds and then more or less implementing various projects that will bring healthcare to the needy or to the masses. So we've undertaken projects like Restoring Hope in 2018, and then we've done Surgery on Wheels, where we supported women to undergo myomectomies, and then also some men to have inguinal hernias repaired. Wow. And then in 2021, we did the Reward a Mask Wearer campaign to encourage people to wear masks in 6 markets in the Greater Accra region.
Okay.
So now we come to the BISAYEN project. So BISAYEN Ask Us and Touch Us project is actually our latest brainchild, and it was a grant that was approved by Pfizer to help destigmatize breast cancer amongst women.
Okay.
So we are using a multi-pronged approach, and one of the prongs of the interventions of this project includes the creation of a breast cancer helpline. So apart from the helpline, we are doing things like educating newly diagnosed breast cancer patients, letting them share their journeys with us. So if they have any fears, they have any myths, if they have any ideas, if they have any expectations, we encourage them to share it. And so you rightly mentioned that it is being executed in 3 sites in Kolebu Teaching Hospital, Konfanochi Teaching Hospital, and Tamale Teaching Hospital.
Okay.
And then additionally, we also go to the communities in these regions. So we've been to a number of mosques, we've been to a number of hospitals on a monthly basis. We've also gone to churches. And recently, just yesterday, we had a team in Kumasi where they went to secondary schools to just increase the awareness.
Okay.
But then importantly, we thought the idea of a breast cancer helpline would definitely give us the opportunity to reach more people,
okay,
those who may not necessarily be in these three regions. Anywhere across Ghana, they can reach out, because sometimes you sit in front of a doctor, you have 1,001 questions, but then before you realize, you either forget, you are a little intimidated, you can't ask all the questions that come into your mind.
Okay.
And so this healthcare, this platform, or the breast cancer helpline, is manned by healthcare workers who have been trained on breast cancer, knowing how to communicate, knowing about the treatments, knowing about the complications, knowing how to detect it, and then also how to more or less communicate and understand.
Okay.
And it's all being done in a very conducive atmosphere. So
right.
we are just encouraging people, not only breast cancer patients, but their relatives or the general public, any questions at all that you have on breast cancer. You may have a lump which may not necessarily already be diagnosed. You are confused about what the next step is, etc. You can call the helpline, and there'll be healthcare workers to help
so
you.
let me ask you at this stage, for the benefit of my listeners, I'm sure there'll be a number, given out. But since we're also, pairing you in hybrid with artificial intelligence, please confirm to me that you are not a robot, right? Because when you say helpline, I'm just wondering, you've trained personnel to be on the receiving end of this call, right?
Yes.
So are we actually speaking to human beings? Have you hooked them up to some AI, maybe Akwesi instead of Alexa, who will now use algorithms, which George will explain in a bit, to actually process what their requirements or their requests or their experiences and feelings and expectations are, and then give them response or support? Are we speaking to real live breathing human beings?
Yeah, so you'll be speaking to real life breathing human beings. However, just like George mentioned, I mean, AI is used in a number of ways. So for instance, if you call the line and there are a number of prompts. So initially they are recordings, but these recordings have been done by real human beings. It's not robotic recordings. So you have a welcome that you're going to get in English. You're going to get a welcome in Tree, if that's your preferred language, Ga, and then also Dagbani. So depending on what your preference is, when you click the or you follow the prompts, it will likely take you to somebody who speaks English, Tree, Ga, or Dagbani.
Okay,
but
based on the sites, right?
Yes, based on the
Kolebu,
sites, yes.
and then Tamale hospitals.
Yes,
okay.
Please,
when we say sites, even though we're talking about an online or telephone-based platform, is it that the teams are based at these sites, or is it that if you have any concerns, you have to move or proceed to these facilities?
Okay, so when we say sites, they are the project sites.
Okay.
So we have health teams in these teaching hospitals who are helping to execute the project. So I indicated that it's a multi-pronged approach. So we have an aspect of the intervention which includes hospital education to breast cancer patients. Some of them have already been diagnosed, they're undergoing treatment. And sometimes there's a crisis moment where maybe somebody has done 3 chemotherapy, the experience didn't go too well, and they are thinking about giving up. So some of these talks more or less gives them an opportunity to ask questions, also get encouragement from healthcare workers to move ahead and finish the chemotherapy. So we are more or less reiterating all the recommendations that the oncologists or the surgeons have given to them. So we are sort of going through the journey with them.
Okay.
And we are saying sites because we have the Kolebu Teaching Hospital, we have the Konfanoti Teaching Hospital, and the Tamale Teaching Hospital. So that's mostly where the healthcare workers are coming from. Well, however, the call agents are not necessarily part of the project team. So the call agent was open to people across the country. We went through a rigorous process, interviewed them, and then we have call agents in various locations based on their ability to speak the local language.
All right, great stuff. 25 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. And I'm in good company. Dr. George Aqua is also a human being, not a robot, but he's into AI as applied to health and medicine. If you have any questions about what this means, I'll be breaking that down a bit with him on Zoom. Also live and human and breathing, Dr. Priscilla van Dijk Say. She's a consultant family physician and executive director of the Global Outreach Consortium. They are running this Bisayen. Ask Us. And I know there's an extension, Ask Us, Touch Us, right? So they are making contact with breast cancer patients and providing them with support along the breast cancer journey, right? So you can call in and actually speak to well-trained professionals who would, should I say, respond to and address your concerns and so on. And this is running at focal points at Kolebu Teaching Hospital, Konfanoti Teaching Hospital, and then the Tamale Teaching Hospital. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and I'm doing my robot dance because I want to break some of these things down. Before I swing to George, Priscilla, so is this a phone number? Is it a toll-free number? Can you quickly just give us the mode of, should I say, was it application, registration, or contact? How do women do this, or how do those affected by breast cancer do this?
Okay, thank you very much. So it's a toll-free number to all those on MTN.
Toll-free for MTN?
Yes, toll-free for MTN for now.
Okay.
Yes. So for MTN callers, so you can call 0800 33 2200 Monday to Friday 24/7. So we have different agents who have ability to speak different local languages, different times of the day. But everybody, you will definitely get
Monday
somebody
to when?
around the clock. Monday to Friday.
Monday to Friday.
0800
33
2200.
That's easy.
Yes, please.
Okay.
Yes.
And it will never be engaged.
No, it will never be engaged. Yes. So it's Monday to Friday, 24/7.
Okay.
The only thing that I have to say is we don't have the languages 24/7 because we don't have enough agents who are able to speak all three languages at each time. Yes, so that was a little tricky.
Right.
Yes,
must it be an indigenous language? Is there English available as well?
There's English for 24/7, and then we also have agents who can speak Twi, Ga, and Dagbani. So I'm just mentioning it. So if it happens that you select Dagbani and it doesn't go through, please try English, because definitely
for starters,
it means there will definitely be somebody who speaks English, but it's possible that the Dagbani speaker may not be the one on the shift at the time.
All right, 28 minutes past the hour of 2 on Joy 99.7 FM. If you are afflicted by breast cancer now, there's a contact line, toll-free, that you can call and get, should I say, professional information, support, empowerment, and so on and so forth, right? Bisayen, Ask Us. You need to get a gun and a Dagbani version of the name, Bisayen. All right, but you can call 0800 33 2200. and then follow the prompts and get the support. If you have any questions, concerns, my WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. We're swinging between that call line or online platform and also AI, for which I have George Aqua in the studio. George, coming back to AI.
Right.
So it can assist us in diagnosis. It can assist us in analyzing data, and many other things.
Yeah.
Right. So can you share with my listeners some of the interesting things we've been doing or that are available now at our fingertips?
So now, ChatGPT, a popular large language model for which almost all of us can readily access on our phones, is readily available. You could reach it for medical advice, for second opinions, for directions to healthcare facilities, healthcare practitioners. Many a time someone doesn't know
Slow down. Let me just see. So the language models, ChatGPT.
Now
it sounds like in this, span that you just shared, you're talking to patients and end users. You're suggesting that end users can now use these facilities and these platforms and these tools.
Yes.
To learn about their conditions.
To learn about
questions.
their conditions, ask questions.
All right.
Yes. But I must say that these models, just like any other machine and even just like any other human, is prone to errors. So whenever you want to engage a large language model, be it ChatGPT or anything, always keep the human loop in it. So in other words, ask ChatGPT but confirm with a doctor.
Right.
Ask ChatGPT about something, confirm with maybe a pharmacist if it's some drug you are inquiring about, because they can potentially make fatal errors too as well, in as much as they can be very resourceful. But the truth on the ground is that all things being equal, they can give you more information. They're actually way more intelligent than humans.
So do I come back to challenge you, my physician? That, I went on ChatGPT and everything you've told me, please, is off the chain. It's not working. But this is what I got from ChatGPT. What is the bridge? What is the, should I say, linkage?
Right. So then the physician must be in a position to know whether the ChatGPT is telling the truth or not. So as per his knowledge base in medicine, and perhaps with even things that the physician might not know, but the model might know, the physician will then be in a position to learn from it. But all things being equal, the physician should know some things about the ChatGPT. You should know what kind of algorithms are being used, the potential errors that can be made.
Physicians,
the database
providers of today should be abreast with AI.
Yes, sir.
Okay. Now, I know both of you. You went through UGMS, right? And so you do a bit of psychology, you do this, you do this, but we were not teaching
AI at the time.
AI.
Yes.
So are you suggesting that we're now teaching?
Yes, we should now inculcate this in the curriculum.
Right.
Both undergraduate, postgraduate. AI is a tool for the world.
The college has a program.
Yes, sir.
Right?
Yeah.
So does it mean doctors are now signing up and, should I say, enhancing themselves in this field?
Yes. So we are gradually putting things together. Soon a committee will be constituted and we'll try and put across some digital courses which will mandate doctors to take to get them to be abreast with these things.
AI proficient.
AI proficient, yes.
Listeners, so you're hearing this. Shortly, I'll activate the phone lines. I know you guys, you are everything proficient. My listeners are wild like that, discerning listeners. So I can go to an AI platform and seek information about my condition, my affliction, ask questions, and then use that to relate and inform my, should I say, exchange with a physician, a qualified person.
Qualified physician.
And George, can you clarify this? Because I know there are certain things you can ask AI to do, and it will tell you it is not equipped to do that.
Yes, it has its limitations.
Okay.
For instance, if you ask it information based on, usually the models are published based on research or data that's available at least 3 years prior to use. So it can give you information up to things that have been done up to say 2021, which have been verified and authenticated. And secondly, some tasks are a bit intricate or complex for it. It will need more training in order to make inferences for you. So it will readily tell you. For instance, if you ask a question like, how much money do I have in my pocket? It doesn't have that training to make such an inference. But if you ask it something like, who is the president of Ghana? It has enough data to make that inference for you.
So the machine, the system or the computer, the program is scanning data and using it to now reason and identify patterns and so on and so forth, and use that to produce outcomes or responses. And we are now leveraging that in healthcare and in medicine. Okie dokie. So this is something we want to be, should I say, seriously uploading, if not downloading, to enhance our health systems. Okay, we know the numbers of physicians and so on and so forth we have is nowhere near enough. So this should extend healthcare.
So if you train the models well, they could subserve rural populations, remote populations. You could go to your chat GPT, report your headache, fever, and things, and it will tell you the disease, tell you what drugs to take if we properly train the model. And then the other thing is, we have to get the model to be FDA approved. And we must always keep the human loop in the circulation, keep some supervision of the sort of the process ongoing.
I'm glad you brought that up. And listeners, I was going to ask him, because the FDA, Food and Drugs Administration, alongside the Ghana Standards Authority, they register and authorize medicines, medical devices, and many other things. So would this fall under the category of a medical device?
Medical device. Medical devices, softwares, and algorithms. They are all supposed to be licensed by FDA before use.
Okie dokie. All right. I'll activate my phone line 030-221-6541. Ultimate Health on Joy 99.7 FM. We're doing a hybrid program. We've got Bisayen, a telephone online-based support empowerment process or platform for breast cancer patients, their families, and so on and so forth. You can call a toll-free number 0800 332 and you will get trained personnel on the end of that line. They will take your questions, your concerns. They are able to exchange or interact with you in indigenous languages. I'm hearing on the menu of languages is Twi, Ga, Dagbani, and was there anything else, Priscilla? Have I left anything out? The language menu.
No, those three, yes.
Yeah, Twi,
and English.
Ga, Dagbani, English, right? They'll break it down with you, and then this is facility-based. It's should I say, a funded Pfizer program running in Kolebu Teaching Hospital, Komfuanochi Teaching Hospital, and the Tamale Teaching Hospital. Any questions on that? You can call in and ask us 055 11 11 997. I confirm, I swear, I affirm I am not a robot, all right? And I'm Enjoy FM. We've also been talking with Dr. George Aqua. He's has special interests. He's a public health physician. He's a physician. He's a lecturer. He's an entrepreneur, an innovator. He's gone to MIT to do data machine learning and all that. But he's live and breathing here. If you have any questions, concerns, 030-221-6541. Ultimate Health on Joy 99.7 FM. Again, George, there are many questions. So now I have a system, a machine that can use all these multiples, millions and zillions of algorithms to, for example, compare and examine and report on, let's say, the X-ray of a 60-year-old man. Right? And it will have some parameters or features and characteristics, right, of the complaint and this and this and that, and actually come out with very, 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 should I say,
accurate diagnosis.
Precise diagnosis and instructions, or recommendations and reports. This is possible.
This is very possible.
And
it's
safe.
Ongoing, very safe. Actually, they even report with greater precision than humans. Partly because they can train on larger data sets than us, and then two, they leverage on the computation power 3, the sophistication of the algorithms too.
Okay.
Given the same X-ray you and I will view, there are patterns the machine or the algorithm can pick up, which your naked eye cannot pick up.
Right.
So it makes them superior to us in that regard.
Right.
But having said that, the training has to be well done through a process we call supervised learning.
Right.
We need to train the models well under good supervision, because this is human life. Any little error associated can mislead us and bring other issues. So for now, the kind of AI we have, generally we term it as weak AI.
Okay.
And even with the weak AI, basic AI,
right.
For any, let's say, 100 X-rays, it can diagnose with some 80 to 9% accuracy. The experienced radiologist might do between 70, 80.
All right.
Yeah. When stronger AI comes, it will reveal much more things and actually turn around the pathological knowledge we know. There are more things that we are yet to see.
All right, George. Let me break this down whilst I'm, waiting for calls and WhatsApp. Listen, I give an array of, let's say, organs or even fruits, which are labeled. Yeah. Right. And I program a system to understand that this is an apple. Yeah. This is a guava. Yeah. This is a banana. Okay.
Yes, exactly.
That is supervised learning.
Supervised learning.
Right.
Yeah.
Now, this system learns all these features and uses that to process. And now, without the labels, it should be able to pick up and recognize a guava, a banana, and so on and so forth.
Sure.
So that is the supervised learning we're talking about.
Yes, exactly.
We're supervising the process of clustering, analyzing, and grouping. Just like your Google Photos, telling you that add a name to the photo so that I can now cluster and show you all photos of Priscilla, all photos of George, and all photos of Nortey, right?
Exactly.
Based on that recognition and supervision, Google is now able to sift out pictures of Priscilla even when you don't want it to do so.
Exactly.
Google can tell you parked here 5 years ago for 30 minutes.
Exactly.
And your wife can say, where were you? What were you doing? Okay?
Exactly.
So that is supervised learning. Right?
Yeah.
Unsupervised learning is where the AI has built this capacity to an extent where now it is seemingly or virtually reasoning.
Yeah, it's able to detect patterns within it.
Right. This cannot be a dog. This cannot be prostate cancer because I can now differentiate it from other conditions, and I can make finer discerning distinctions and differentiations than the human doctor.
Exactly.
At greater speed and
efficiency. Exactly.
Okay, folks. So you should also be able to, by supervised learning, now know my phone line 030-221-6541. Also know that we are on Facebook and YouTube, and my WhatsApp is 055 11 11 997. I want to hear your questions, your concerns with this. With that, let me come back to Priscilla.
Yeah.
Doc Pris, are you there? Oh, I'm not hearing Priscilla. Okay, Abeku's done something, right? That's why I need to use AI.
Hello?
Yeah, okay. Right. With the AI, I would have done that without Abeku having to do it. But so what kind of response? I know you've done capacity building. You trained your call receivers or call center professionals, right? What have you got a response? Are you at the, should I say, program phase where now these lines are active and people are calling? What's it been like?
Yes, so we had our launch on the 11th of June, the official launch of the whole project.
Okay.
And we unveiled the number as well.
Okay.
But we hadn't fully engaged all the call agents. However, a few calls came through, and it varied from reassurance. Maybe there was a symptom that they needed clarification on, and they were able to speak to our project staff on the ground so that they get clarity. And then we also, because we are also in 3 teaching hospitals, if it happens that they actually want somebody beyond their personal clinicians, that can be done as well. Okay. However, since Monday, which is the 15th of July, that's when we actually started receiving calls from our agents. So we've had a few calls come in, just clarifying symptoms, clarifying what to do. Should they have a lump in their breast? But it hasn't been too busy.
Okay.
But we are hoping that with this sensitization,
All right.
more people will be aware of it. I also wanted to clarify that the call centers are not based in those facilities. It's actually we are using AI again, and so we have consultants who are helping us.
Virtual centers.
So people do, yes. So they do it through the comforts of their homes. So they use their phones and then the laptops, and then they get onto the helpline platform and engage the those who call in that way.
Okay.
And then I would also want to say that we have a number for those who don't have MTN, but then regular call charges will apply. So if I can share that number.
Yes, you can.
Okay, thank you. So that number is 030-824-9430. 030-824-9430. So that one, regular charges will apply, but for the MTN, it's toll free. And so, yes, thank you so much.
So that number is actually what we call the chuchu blema, kring kring landline, eh?
Yes, or I think they said something about the long number.
All right.
Yeah.
Okay.
Yeah.
So
thank you.
There's a landline available as well for Bisayen. I want a guy and Dagbani version of the name. I insist. All right. Otherwise, me Bisaobio. So, folks, my phone line is active 030-221-6541. WhatsApp is 055-1111-997. If you want to ask anything about AI and medicine, healthcare delivery, I've got the man in the seat, Dr. George Aqua. And if you want to ask about, empowerment support for breast cancer patients through an online call platform, I've got Dr. Priscilla Van Dyke Say on Zoom as well, right? So those channels are active. Abeku, can you swing and see if we have some WhatsApp there? Maybe questions. Let's see now. Okie dokie. I'm already seeing something about why 3 languages. Good afternoon, Nortey. Surprised you mentioned that a restaurant asked you to scan a menu. I went for a takeaway Chinese yesterday, and when I requested for the menu, I was asked to scan. I wasn't amused as my phone storage is nearly full. I ended up taking a shot of the bits I needed on the counter. This is from Nana. Nana, you and I, we are old. We are old. We are past it. Okay. Abeku, can you scroll to the next one? Where's my mouse? Okay, here it is. No, he's moved it. Okie dokie. Scroll down. What have you done? Looking for mice, all right? Proper kusie. Abeku, please come and get my WhatsApp. I have too many mice on my counter. Right. Good afternoon, Nortey. Please, I missed your call during the week for the invitation for the dental clinic. Kindly assist. I want to know the location and the time. Hetty, yes. Platinum offered to give a screening for a couple of our listeners when we did the elder dental care, right? Dental care for the elderly. We've sent some names to them. So if you are amongst the list, you will get a call, right? We didn't have that many to cut down from. So I think Hetty, was Hetty one of them, Abeku? Right. Okay. So Abeku will confirm that, and then we were only able to accommodate 3. Was it 3? Yeah, 3. So, but if it's about location, they are on the Finale Drive next to the Lister Hospital. Okie dokie. Good afternoon, Nortey, and how are you and your invited doctors? I'm lost about this vital education, but today I'm listening live. This is Hayford from Bato. Good afternoon, my brother. Why only 3 languages? What happened to the others who can't speak these languages? There's English, Hayford, and it's because the funded project is cited at our teaching hospitals, 3 of them, Kolebu, Konfanochi, and Tamale, right? So that's why those initial languages. I'm sure as it expands and as George lays his tentacles on them, they'll offer more using more AI, right? Yeah. Any questions, calls, 030-221-6541. Let's get your calls about AI as well. If you have any questions, concerns about breast cancer, whether you've been diagnosed or you are worried that you may have a suspicious development or lump, 0800 332200. All right? Okie dokie. Yep. So, George, coming back to risks, okay,
Yeah.
can anybody, any doctor, any practitioner suddenly say that, okay, rather than come to the College of Physicians and run a program, an accredited program, in maybe this or that, I've gone and done a program on AI.
Yeah.
So all the other courses that the college runs, I don't need them.
Yeah.
How are we really going to bring this on board?
So we need to first of all, we need to streamline it into main training from the undergraduate level, and we need to examine them. And at the postgraduate level too, every residency should have a slot for technology.
Okay.
For example, if you are examining a medical student or a medical doctor to graduate, in addition to getting him to physically examine the patient, you should test his ability to use the chat GPT as we would expect, so that we are sure that they are well equipped to manage situations manually and then also using technology.
Okay.
The technology in advance.
For example, let me say, rather than specializing in psychiatry, right, I go do AI. And then I ask him all the psychiatry questions. But I'm not a specialist in psychiatry according to our training, what the college and so many, can I do that? Can a doctor do that?
No, it's not ethical
at
the moment.
Doing plastic surgery because I've asked AI what to do, how to shape your face and all that.
For now, we can't. But that time is going to come where actually robots will perform better plastic surgery than humans. That time will come where AI can practice better psychiatry than the doctors, but not now, not anytime soon. Okay, so in the interim, we still need to train the doctors.
It's spooky,
and then we need to.
It's frightening. Oye Nafenya, you're welcome. I hope you are still Oye and not a robot. Who else do I have on my WhatsApp? Okie dokie. Right. Any questions, concerns? Phone line is 030-221-6541. Ultimate Health on Joy 99.7 FM. We're talking about artificial intelligence in health and medical care delivery with Dr. George Aqua. Tomorrow, you're delivering a presentation on
lecture,
that.
Yes.
Where?
At the Ghana College of Physicians and Surgeons.
Okay.
Yeah, Ridge Runabout. 3 p.m. tomorrow. It's a public lecture and it's open to all.
So the public can attend?
Public can attend, yeah.
Okie dokie. That's the Ridge Roundabout?
Ridge Roundabout, yeah.
Okay, off the what we call the Liberation Square.
Liberation Square,
Circle.
yeah.
Yeah, okay. College of Physicians, 3 p.m.
tomorrow.
Right? George, and then there's another presenter in the U.S.
Yes, Dr. Yakuma Crystal. Right. She is a pediatric endocrinologist at the Vanderbilt Medical Center.
Okay.
She's in here at the moment to join us tomorrow.
All right.
At 3 p.m.
She also has another qualification in something bio.
Yes, she's the head of the clinical bioinformatics unit at the Vanderbilt Center.
Wow.
Yeah.
Clinical bioinformatics.
Yes.
Jeez. Hey, Charlie. It's not easy, right? So we can do these things.
Yeah.
We are, should I say, in the process of doing some of these things which are being done elsewhere.
Yeah.
At a higher and more advanced level.
Yes, exactly.
Okay.
Yeah.
And we're saying that our physicians, our doctors of today should have a certain basic, if I can't, maybe primary proficiency in AI.
In AI,
to
exactly.
speed these things
up. Yeah.
Okie dokie. Folks, you already know that we are doing information management systems. Folders and things are becoming obsolete. All your data is on some cloud that a hospital has, but they can now seamlessly consult. Somebody can sit
these
in
are
the US.
rich sources of information
Rich data.
For work to be done. Just that because we don't know the AI, we cannot harness that.
Okay.
If we know it, we can actually make predictions with the information we have. We can personalize treatment. In the case of these breast cancer survivors, we can personalize treatment for them. We can we can enhance diagnosis through the various imaging modalities we have. vis-a-vis electronic medical records we have on the wards, we can make use of data. Actually, we are underusing data in our part of the world, largely because we lack the data science proficiency. We lack artificial intelligence knowledge and skills down here, not only in medicine but virtually everywhere. So there's a need for a national, a concerted approach to bring these things down so that we can make a lot from data.
All right. So it means also that we can now look at diseases and trends and epidemiology and all that.
Exactly.
And relate it to patterns of behavior,
and
lifestyle,
pick up new patterns.
And pick up trends.
Yes.
Should I say structure-informed programs of intervention.
Exactly.
We can predict
you
what
can
might be happening to somebody
models.
in 10 years' time.
Exactly.
Right?
And you can actually personalize treatment.
Wow.
Yes, it's not every drug that works for everyone.
Okay.
And with the right amount of information, we can build a model that can tell what will exactly work for you in your situation.
Righty.
Yeah.
Right. So there's so much at our fingertips.
Yes.
Okay.
Yeah.
But it does need regulation.
We need regulation too.
It does need licensing. Because even in the current regime, we have many quacks. And many cases of medical malpractice and mismanagement.
Yes, sir.
Okay. Yeah. So are we not giving free license to all these geeks around who can just go in there, hack a system and say, well, I've looked at Kolebu's data and now these are the trends and these are the medications and these are the interventions.
Yeah, so if we leave things open, that's what will happen. So we need very stringent regulations, laws as to how data should be handled and stored. We need to understand the whole ethics governing data management, privacy, confidentiality, the need to protect data, mechanisms of storing and retrieving access. We need training on these things.
Great stuff. Talking about data management, well, my small brain can process this. We did and Platinum Advanced Dentistry, Orthodontics and Advanced Dentistry. They were on the program a couple of weeks back, and they offered some free cleaning and screening for persons above, I think, 60 or 65 when we did the geriatric dental care. From what I have before me, Koko Mante, you should receive a call. Aite Ajini, right? Aite, you also will receive a call. I believe you are all supposed to be seen, hopefully, Friday the 26th. And then the last one is Delphinus. Hetty, I'm told by Abeku that they called to notify you that you didn't make the cut, okay? But the facilities and the processes are available at Platinum. But the free candidates or listeners who, after our processes, are Koko Mante, Aite Ajini, and Delphinus. There was a surname for Delphinus, but I'm sure he knows, and the numbers have been given out to Platinum. Thanks again, Platinum. We'll still be squeezing out some stuff from them as they are celebrating their 10th anniversary. Right, I have a couple more issues here on my WhatsApp screen. This one says, good afternoon, Nortey. I'm an active and addicted Joy FM. Okay, there's a confession of an addiction. Right, listener, but I haven't texted you before. I just want to say good show by your guests. They should keep the education up. Kudos to you all. Lovelace Nanayao in the UK, the United Kingdom. Thanks. Stay tuned as always. Let's see what else I have. Priscilla, is there anything else you want to share with us whilst I'm screening through my data like a robot? Okay.
Yes, so the response has been good, and we've had a few instances where people ask us if we are also doing clinical breast examination as well, which is like screening. Yes, but we tell them that for the funded projects from Pfizer, it's purely educational. So currently we are inviting corporate entities and other individuals who want to sponsor clinical breast examinations in selected communities. They can reach out to us and let us know that this is something that they want to do. So the whole thing is to ensure that the conversation about breast cancer is not limited only to Pink October, so that throughout the whole year
there's education,
let
information,
know
and Right, and
they can
empowerment.
get support for breast cancer. And if people have challenges, they shouldn't wait till October before they get help.
Okay.
Thank you.
I know based on your personnel, your capacity, there should be some ongoing expansion or growth. But a couple of listeners, or I think one particular listener, asked about the menu of languages. Should we expect some expansion in that regard?
Not in the current project, but it's something that will definitely let funders know that it would be great if we can have many more languages on board,
All right.
so that the clock, irrespective of what somebody's local language is, they can
Okay.
get help.
All
And
right.
then, importantly, maybe beyond the project, get people who are more or less employed fully for this, because
Okay.
we are actually using call agents whose main jobs are healthcare.
Okay.
And so they are using their time offs, etc., to do this as well.
Okie
So
dokie.
going forward, if we are able to employ people fully who are healthcare workers,
Okay.
and then that means the population should be commensurate with what they would get if they were working full time.
Alrighty. Okay, that sounds good. Now, can you give us? I know you have a Global Outreach Consortium has a web page, something.org, global.com or something
Yeah,
global.com.
global OC, so it's www.globaloc.org.
Right.
And if you want to know more about Bisayen, it's /Bisayen/.
Okay.
And then we are also on social media, Bisayen Axe Touch on Facebook,
All right.
Instagram, and X. Yes,
Okie
thank you.
dokie. Right. Thank you very much, Bisayem Hima. Dr. Priscilla Van Dyke is the executive director of Global Outreach Consortium. They are running this project, Bisayen, for breast cancer patients, families, and so on. I recall, by rote now, the toll-free number 0800 332200. Priscilla, can you quickly give us the landline?
It's 0308 249 430. Thank you.
Right. So you got those numbers. Thank you very much, Dr. Van Dyke. And Dr. Aqua, you're presenting on this. I'll make a point to be there, right? Especially
we'll be glad to see you.
When it comes to what we can do, and especially when it comes to mainstreaming this in the training of our physicians,
yes,
right,
and other healthcare
practitioners. So this is a field doctors should aspire to get into.
Yes,
and to enhance their should I say proficiency.
Yes,
in.
Yes.
Okie dokie.
Right.
Many thanks, Dr. George Aqua, physician, innovator, entrepreneur. He's also the head of president of Adisco. Which year?
2005.
One course school, Papa.
Oh, it's a college or a school.
I'm kidding. That's why, he's a good friend of mine, and so is Dr. Van Dyke but he went to a disco. Forgive him. He should have come down the road. Come down the road. But good work, George. You're always growing, and good work, Priscilla, as well. Always a pleasure to meet you in this mood. In this stage of life, sometimes I forget that, Charlie, I'm old. Great to have you. Thanks for enriching our program and empowering our listeners.
You taught us years ago.
I taught you.
Well, I know you taught me, yes.
And George.
Yeah.
But Priscilla, I remember you for many years, even after you qualified, I had you as a class rep.
Yes,
you were a class rep in the earlier years, so I had Priscilla Van Dyke class rep. Now she's consultant in family medicine. Many thanks, and keep up the good work.
Thank you.
Yeah, and George, same for you. Maybe we should limit you on the business, but you're doing all of them: the academic, the clinical, the entrepreneurial, and the innovation as well. Right?
Yes, sir.
Keep it up.
Thank you, sir.
All right, that's a wrap from me, live, breathing, non-robotic, and Abeku Sankofi. He'll play some robot music very, very, very soon. Stick and stay on Joy 99.7 FM. My name, Nortey by nature. Very soon they'll have a clone of me, and that will be bad news. Stick and stay. I'm out.